Hello, my name is Yesenia Reyes, and I will be conducting an abdominal exam on our volunteer patient. For sake of privacy, we're going to do the exam with the shirt on, but ideally it would be with the abdomen exposed. So for the first portion of the exam, first we start with inspection of the general appearance of the abdomen, looking for areas of any asymmetry, if we see any areas of bulging, general color, also for any herniations, any striae, scars from previous surgery, anything like that. Also, we'd be looking for any pulsations of the abdominal aorta, which I don't see any, and then just general movements of the stomach. Next, we're going to go ahead and start with the auscultation. We're going to be starting in the right lower quadrant first, to start with the sacrum of the feet. Okay. So listening in all four quadrants, we're looking for any areas of hypoactive bowel sounds or hyperactive, but his are normal active. Next, also just be taking a listen to any bruise in the aorta. Okay. And there's no bruise heard within the aorta. Next, we're going to go ahead and start with the percussion to start looking around the different tympani in the colon area, any dullness in the liver area, hyperresonance in the gastric bubble. We're going to go ahead and start there. So along the colon and getting tympani. And then we'll go ahead and start percussing for the liver, which is about right here. I'm just comparing to the resonance of the lungs versus the liver. And then here we're going to feel for hyperresonance for the stomach. And then we're also checking for any dullness in this area for any spleen enlargement, which I don't hear any. And the spleen area. And then next we're going to go ahead and start with palpation, just feeling lightly first in all four quadrants for any masses, anything movable, any tenderness with palpation. You feel anything? Okay. So we're just feeling there, general feeling of the stomach, no masses being felt. Okay. Next, we're going to go ahead and also do deep palpation, starting here in the right lower quadrant. Palpating about 5 centimeters. Now you're going to take a deep breath and let it out. Just trying to feel for the liver border. Deep breath, one more time. Okay. And then next, we're going to go ahead and feel deeply palpate here. And then feeling for any distension in the bladder, which I don't feel any. And then next, we're going to have the patient turn on his side so we can feel for the spleen. Okay, now with our patient on our side, we're going to go ahead and feel for a splenic enlargement and just for a position generally. So we're going to have you go ahead and take a deep breath. Okay, one more time. Okay, so no enlargement felt with the spleen. With the palpation in the general abdomen and the spleen, I'm also feeling for any rebound tenderness, rigidity, guarding, looking at the patient's facial expressions, and overall appearance with the palpation. For our next step, we're going to go ahead and have the patient sit up so we can check for tactile fremitus in the kidneys. Okay, for our last portion of the video, we're going to go ahead and check for tactile fremitus in the renal region. Any tenderness? Any tenderness there? Okay, then we're also just going to palpate the spleen on this side. And it's not felt. And that concludes our abdominal exam.